All right, we're doing group 6 is a treatment plan for Rebecca Fuller. I'm Jason.
I'm Anthony. I'm Aaron.
I'm Eric.
To start it off, patient six is patient six name is Rebecca Fuller. She's a 21-year-old college student who is studying to be a nutritionist. 1 month ago, Rebecca was driving back to her dorm after the dinner shift at the local diner she works at. She's a waitress. When her phone rang, she looked away from the street to find her phone when she swerved off the road and caused the vehicle to roll over. Rebecca was not wearing her seatbelt and was thrown 100 feet from the car. Rebecca woke up the next day in the hospital to find out that she was paralyzed from the waist down. Yesterday, she was released from the hospital and moved to rehabilitation center. Rebecca is hoping to return to school next semester.
Well, we can't create a plan that will help her walk again because she's paraplegic. We can perform exercises to help her strengthen her upper body, which helps because most of her movement will come from her upper body now. So our plan will be to help her regain autonomy by helping her get out of bed by herself, bathe and dress herself, use the restroom by herself, and be able to transfer out of her wheelchair by herself, as that'll be her main form of mobility.
All right, Rebecca Fuller has some unique physical needs. Mainly, she's unable to walk, stand, or any functions pertaining to her lower half of the body that she's unable to do. So she's going to need to be taken care of by family and friends. And that would include waist expulsion, changing like catheter and all that sorts of things. And her primary transport will most likely be a wheelchair.
All right, what to expect? Rebecca's injury and new lifestyle will be difficult for her to grow accustomed to. In the months following her injury, we can expect her to become rather depressed due to, becoming a paraplegic and being unable to walk. And due to her not being able to walk, she's going to have to depend on family, friends, all that sort of things, just to complete everyday tasks. There's also the possibility of pain caused by damaged nerve endings. As for what we can expect from her progress towards recovery, it is entirely dependent on her willingness to cooperate with the proposed treatment plan. All right, here's an outline of the next 6 months for Rebecca. The first month is mainly just going to be for her to get accustomed to her new lifestyle. Most of her daily activities will have to be assisted by family and caretakers. Second month, her physical therapist will have to ensure that she practices leg exercises to ensure that her legs don't atrophy or develop contractures, as well as a basic upper body workout regime to build arm strength. By month 3, Rebecca should be accustomed to her new lifestyle and can be taught several techniques to increase her independence. The first of which is some basic stuff like getting out of bed and in and out of a wheelchair. By month 4, the next major goal would be changing clothes and bathing independently. This is another important step towards her previous standards of living. By month 5, which is going to be the last major goal for Rebecca, it's be able to use the restroom unaided. This relatively simple feat will determine how well she has adjusted to her new lifestyle. By month 6, she has mastered simple tasks that she'll have to encounter on a daily basis, and we can determine whether or not she wishes to drive again. From there, we can plan the next course of action.
The nature of Rebecca's injury, with her being paralyzed from the waist down, a typical occupational therapy session will focus on developing the muscles of her upper extremities, which will help compensate for the loss of her mobility in her legs. Through the use of weights and dumbbells and pulleys, Rebecca can progressively strengthen her arms. This is ideal because most of her mobility will come from using her arms now. So typical physical therapy sessions will primarily focus on the direct factors that will hamper Rebecca in her road to recovery. For example, stretching out her legs, the muscles of her legs, even though they're no longer functioning, it can still help in preventing other possible complications from forming, such as the formation of contractions in her muscles and the atrophy of the muscles in her legs. And much like occupational therapy, physical therapy will also focus on the development of her upper body and upper extremities, because that's where most of her movement and maneuverability will be coming from now, due to the loss of functioning of her legs. So using the similar equipment, dumbbells and weights, we can also develop the biceps and triceps and deltoids to help develop the strength of her arms and help her with things like moving her wheelchair. She's capable of functioning on her own again. So a nurse would help dress her, help her get out of bed, help her use the restroom, and things of that nature. Just everyday activities.